everyone, welcome back to Clinical Cousins YouTube channel, where today we're going to go over the drug Levodopa Carbidopa, also known as DuoPar. Now this drug is classified as a peripheral decarboxylase inhibitor and an anti-Parkinsonian agent. The indication for this drug is Parkinson's disease. Now the contraindications for this drug include monoamine oxidase inhibitors within 14 days. As we already know from our previous videos, monoamine oxidase breaks down catecholamines. If we inhibit monoamine oxidase, then we will not be able to break down our catecholamines like dopamine, and they will have a lasting effect on our body. Meaning that dopamine will have a greater effect than anticipated. Use caution when giving to patients who have sympathomimetic drugs like Adderall, norepinephrine, epinephrine, or have severe mental illness that requires medication. Now for pregnant women, although it has not been proven dangerous, it is very likely that this drug is teratogenic, so use caution. Now, as we know from our biogenic amine synthesis video, L-Dopa is the precursor to dopamine. People with Parkinson's disease lack the neurotransmitter dopamine. However, we have a problem. Our blood-brain barrier does not allow the passage of dopamine directly into our central nervous system, or our brain and spinal cord. Therefore, we must give our brain the precursor L-Dopa. L-Dopa. This is why we give Levodopa. However, we have another problem. Our peripheral tissues have dopa decarboxylase, which we know will convert our L-Dopa to dopamine. This is why we have Carbidopa. Carbidopa occupies these decarboxylase enzymes so that L-Dopa can pass through our blood-brain barrier and into our brain, which will then receive the dopamine. Now, this drug will have effects that will last around 3 to 5 days, but will likely need frequent dosing. Some side effects for this drug are agitation, sleepiness, confusion, problems with temperature regulation, and edema. Some commonly tested material about this drug is that it is a treatment for Parkinson's disease, that Levodopa is the precursor to dopamine, that Carbidopa helps prevent the breakdown of our Levodopa, and lastly, please remember that this drug cannot be given within 14 days of a monoamine oxidase inhibitor. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.